According to the latest medical research, younger men are prone to experiencing heart attacks. The data adds that cardiovascular issues are no longer just linked to the elderly, with 1 in 5 heart attack patients being younger than 40. So experts say with a few lifestyle changes, heart disease is preventable. Let's unpack this further. We are joined by Dr Tiny Mhinga, who is a medical practitioner and joins us in studio. Thank you, Dr Mhinga, for coming into studio. It's great to talk to you on what is an incredibly disturbing story. Is this new research insofar as the statistics as they relate to young people?
I think, look, I think there's just too much reporting, more than anything else, because we still have older people ourselves at my age getting heart attacks. A week does not go by without you reading something about heart attacks. But it's true that younger and younger men are starting to get affected by this condition.
Sure. It's worrying, isn't it?
It is a worrying thing because, and I think you mentioned a very important thing, the lifestyle. Yeah. The lifestyle changes that, people are not taking very seriously. It's not only your doctor who's going to make you, avoid heart attacks. It's what you do with yourselves, particularly at this age. I mean, I can say it right away openly that we see more and more younger people who are overweight, who are not exercising. They are not doing much about their own body. They don't listen to their bodies. There's nothing wrong in partying if there was not too much drinking and too much meat eating. And unfortunately, in this country, in this continent, most people get into problems because of the high content of salt that we eat. Right. We loading ourselves with so much salt and red meat, that ultimately leads to all sorts of problems. And it's happening every day, So
you're talking now about some of the causes behind heart attacks, and you've already mentioned so many of them. Smoking is another big factor. You've already talked about the excessive salt intake, heavy drinking, the lack of physical activity. But here's the difficult one. Long-term stress. We've just come out of 2 years of a pandemic. That's a difficult one to manage.
It is. I mean, of course, we all have to learn how to deal with stress. And one of the best way of distressing is physical activity. You think that if you're stressed up, you're going to take a glass of wine today and tomorrow. The problem still remains. You take a cigarette, you're not running away from it. So you have to find a better way of dealing with stress. And I think it's so difficult to deal with stress on your own. You have to go and report it, maybe to a clinical psychologist, to your doctor, so that you can try and unpack the reason, because you won't be able to deal with the stress unless if you go to the bottom of it. But all this is that I just mentioned, the drinking and everything else, and smoking, and in fact, including drugs, you're just covering the surface. At the bottom, there's still a problem, a big problem. And
one part of the research that I find very interesting is that part of the statistics talk about 1 in 5 heart attack victims being younger than the age of 40. And in the preceding months before the heart attack, there are no signs or symptoms of, for example, high blood pressure, hypertension, or high cholesterol. So here I am. I don't have any outward symptoms of suffering from these lifestyle diseases, and a heart attack takes me out. Yes. What should I be doing to prevent that?
It's very unfortunate that a condition like hypertension or cardiovascular diseases don't have symptoms.
Outward symptoms.
Outward symptoms. Like, for example, if you had TB, you'll be coughing, you'll have a fever, you'll have lack of appetite, you start losing weight, and all sorts of things. And even by just telling somebody, most people would know that if you pack all those symptoms related to one problem, which is TB. But heart diseases, hypertension, high cholesterol, no symptoms at all. In fact, that's why it's mandatory for everyone to have his own medical practitioner who profile them. And you profile taking into account who the person is, yourself. If you come to me, I have to take your history, your family history, where you come from, your mother, your father, your grandfather, just to write a few things. And I'll say, you know what, at your age, I think you should start taking this seriously. We check your blood pressure. If it's fine, it's okay. We'll check you again next year. But most people don't do that. And you think that if you're 40, you're still too young to have a high cholesterol. Until you do take a blood test, you will never know that you've got high cholesterol. And not only that, and it's a combination, we call them the triad, including diabetes. Most people don't know that they have diabetes. You probably have certain symptoms, but you tend to ignore them. And the history is very important. So we document all that information. We put it together and we say to you, it's time for you to go for this and this. You check your blood pressure once, second time, third time, we say, look, we have to treat you.
Yeah.
This is, and of course, we add all those things that we see in you. You're overweight. Your history doesn't tell us much about your physical activity. You've got a big history, terrible history about your family who have any one of those conditions. So you are actually at risk.
I mean, what you're talking about there, about having that annual checkup, that's a difficult ask in a country like South Africa without access to healthcare in this country.
Yes and no. But you'd be surprised that most people who actually go out and look for medical care are the ordinary people. That is from my experience. The ones who think that they have the money, they have the resources, they don't care. Do you understand? Most of the people, I mean, I practice here in 4 ways. I see people from Diepsloot want to know what's happening to them. I hardly see anybody from Houghton coming and say, can you check, unless if they have a problem. So don't wait for a problem. Because by the time you start having certain symptoms, probably it's too late. And I'm not
okay. So maybe this is a good time for you to give us a sense of, if outwardly I am not overweight, I'm not gasping for air, I don't have any outward symptoms of hypertension or cholesterol, what are some of the other signs that I might look out for?
You know, on Saturday, I was in my rooms, a couple came in. The problem is that they've just moved into a new house. They were staying in a standard house, which is 1 floor, and they've just moved to a new house, which is double story.
Right.
And on the second day, she tried to go up to the bedroom. She said when she arrived on the first floor, she felt like the chest was tight. She had to take a breath. So when you do exertion, and of course, stairs is a normal thing that we talk about, but even when you do ordinary manual work in your own house, doing a little bit of garden, trying to jump from here to there, that's exertion. That puts a lot of stress in your heart, in your blood vessels. Then you feel like you're not breathing properly. Right. There's a bit of pain. And in fact, it's not the pain that is important when you have those conditions. It's the pressure that you have in your chest. And unfortunately, with women, you don't have, with men, you have the typical movie star type of a heart attack. You have pain and then you cry, you lounge onto one side.
Yes.
But with men, it's nothing like that. And this is what we see lately with women. They have maybe a little bit of a headache, they have a little bit of nausea, they're feeling a bit lousy, you know. And if you're sitting with them, maybe on a Sunday afternoon, you're having your afternoon teas, a woman will say, can I just go and take a nap? And that nap, unfortunately, may be your last nap, because that's what we find. And people die in their sleep, women in particular. With men, it's obvious. Heart attack, you're in a golf course, you're trying to run, is this kind of the movie type of pain that you see on the movie. That's what happens to men, but not a lot with women.
So just some final comments, Dr. Mhinga. You should be getting a physical at least once a year. At what stage of my life does it become critical that I do these checkups on a regular basis?
I would say 35.
From 35.
If you don't have a bad history from your family. So the family history is very important, because that's what gives us some kind of a lead. With all the diseases, whether it's cancer, it's cardiovascular disease, and the like, history is the most important thing. So we sit down and take a family history. We want to know who you are, where you come from, your grandmother, your aunt, your uncle, and everybody else. But normally we say 35. It is important that you take. But if you have certain risk factors, rather reduce it by another 5 years.
So start from 30, not 40.
Yes, you did. We see a lot of young people with terrible readings. They're scary.
Sure.
And you can walk around with a blood pressure of about 160, 170, over 100. You don't even know about it. And some of them collapse in the gym. Twice I was called, of course I was in the gym, because you always have to record, I'm a doctor, I'm in here.
Yes.
Somebody starts having chest pains. And you will check on the treadmill, it's running about 160 on the meter. So that person must just get a rest, call an ambulance, the guys are there to come and help.
Well, there you have it. Some interesting and critical advice there. Dr. Tiny Mhinga, thanks for coming into studio this morning.
Okay.
Honestly, on a personal level, I thought from the age of 40 you need to start doing those regular checks, but we're now hearing heart disease is affecting younger and younger people. You should be getting those checks from as early as the age of 30. Some important advice for all of us there.